In this month's episode of CP Diaries, I discuss preventative health with CPSN's telehealth nurse, Amy Seeary. Amy has 16 years of nursing experience, is the mum of twin boys with CP, and is very passionate about preventative health.
Hi, so I'm excited to be sitting down with you. Thanks for taking the time out of your busy schedule to chat with me, because we've got to cover preventative health, which is something I've wanted to do with you for a really long time.
Yeah, thanks so much for having me again, Nat. I'm really excited about this topic. When we first spoke about it, I said, this is something I think about a lot, and it's something that, I really want to put a focus on for our members, our clients. It's something I talk about with my telehealth clients all the time. We need to look after ourselves, and there's so much we can do to prevent serious illness and disease.
Yeah, and I suppose this is something that probably touches home for you as well, as someone who has two boys with cerebral palsy.
Yeah, absolutely. And, this is something that we think about really early on with the boys, because we know that they are at increased risk of certain things, especially with their hips. And so one of the earliest things we do for kids with cerebral palsy is hip surveillance. And so looking at their hips, are their hips forming right? Are they in the socket where they're supposed to be? And so my boys get 6 monthly hip x-rays, which, is for a preventative measure to make sure their hips aren't dislocating.
So before we get into the deep of it, I mean, there's a lot of medical jargon out there. So what would you say preventative health is?
Yeah, definitely. So preventative health, I guess put simply, is on the one hand, looking after yourself. So doing things in your lifestyle to prevent the chances that you'll get an illness or disease. So those things that we learn early on, having a good diet, exercising, not smoking, not drinking above the recommended amount, putting on sunscreen to prevent skin cancer, things like that. And then on the other hand, there are some more active measures we can take. So immunisation is a really big one that most people start very early on. So we prevent illness through immunisation, along with some screening measures. So skin checks, cancer checks, things like that we can unpack a little bit more in a moment. But so you've really kind of got, your lifestyle side of things, and then you've got your preventative health checks as well.
So what are the most common conditions in Australia?
So for quite some time now, one of the most prevalent conditions is heart disease. So we know that more Australians die of heart attacks, heart disease every year than any other condition. Up there is still cancers. So for women, breast cancer, for men, prostate cancer, but then things like skin cancer. Australia has one of the highest rates of skin cancer in the world. Mental health, mental illness is really prevalent right through the lifespan. And then we know that things like, musculoskeletal conditions, so things like osteoarthritis, osteoporosis, things like that have a really big impact on Australians every day. One of the biggest things and chronic illnesses that impacts Australians is back pain. We know that 47%, so nearly half of Australians are living with a chronic condition. So a chronic condition is something that a person lives with every day. So it's not acute. So an acute illness is something that perhaps you say, like appendicitis, you get it, you get treatment, and then it's done. Whereas a chronic condition is something that you have for quite a long period of time. So things like back pain or diabetes, epilepsy, things like that. So we know that almost half have a chronic condition. And we know that quite a large percentage of that half, those chronic conditions can be prevented with lifestyle changes. So yeah, they're kind of the biggest ones still at the moment.
And I guess it's interesting that we're talking about this, because really when you think about it, cerebral palsy, though it's a disability, it's a chronic condition. And on top of that, you're mentioning some things that I know I've been told to be cautious of, like osteoporosis. Are there certain conditions a person like myself with CP is more at risk of getting, and why?
Yeah, absolutely. We do know that unfortunately people with cerebral palsy do age a little bit quicker, so their body changes in relation to the symptoms of their cerebral palsy a little bit quicker, particularly around arthritis, changes to their musculoskeletal system, so osteoporosis. Even in childhood, we know that osteoporosis for kids with CP can come on a bit quicker. And like I mentioned before, they can have issues with their hips from an early age. We also know that for some people with CP that have dysphagia, so trouble swallowing, there can be a much higher rate of respiratory illness, so things like pneumonia, chronic pulmonary disease. We also know that for some people with cerebral palsy that have trouble moving around, there can be increased risk of weight-related illness, diabetes, things like that. The thing that didn't really seem to be any different in populations with cerebral palsy was things like the risk of smoking, drinking too much alcohol. That seems to be fairly well on par with the rest of the population. And as for mental health, we do know that people with CP are more likely to have mental illness, but the impacts of that in relation to the rest of the population is probably fairly similar.
So aside from revealing that we like a drink as much as everyone else, I mean, some of those other ones you touched on, I think, geez, how do we reduce a particular risk of that, especially if you have something like the acid reflux that you mentioned? How do we prevent those or minimize the risk?
Yeah, absolutely. And, you know, one of the most common questions I get in telehealth is, help me find a GP with a good knowledge of cerebral palsy. And I think that's a really great place to start. There's not a huge amount of them around, but I think when you can find a GP that either knows about cerebral palsy or is willing to learn, I think that's a really great place to start. So a GP that's willing to look at what are the things that you could experience as you get older. You know, traditionally there wasn't a great deal known about cerebral palsy and the aging process. There hasn't been a great deal of research done on it. But now more and more there are guidelines coming out for GPs to use around working with adults with CP. So I think the GP relationship is really important to be monitoring your health. You know, going to the GP, and this really is for any Australian, to have a regular health check. So checking up, you know, your weight, your waist circumference. We know that things like that are really, really heavily related to your risk for heart disease. Having skin checks, you know, having your blood pressure checked, you know, discussing your daily life and the way you live. You're smoking, if you smoke, you're drinking, you know, things like that. We know that's really important to maintaining a healthy lifestyle. And we also know that by having regular health checks, the GP can keep on top of your need for, you know, screening. So things like pap tests, prostate exams, skin checks, you know, keeping immunizations up to date, things like that.
So it's interesting there. You put a lot of emphasis on the need that people really need to connect with their GPs. One of the things I've noticed doing CP Diaries, speaking to other people with cerebral palsy, especially adults, is that they've had some pretty negative experiences going to their GPs. How can they make sure that all of their needs are being covered in that in that medical visit?
Yeah, and it's funny you say that, because I was actually reading a research study that said just that people with cerebral palsy, with disability, you know, sometimes go to the GP and have a really negative experience because they feel that their disability is overshadowing everything else. So they feel that the GP is just seeing their disability and not thinking about those preventative health tests and measures that they would with anybody else. And so we know that where a person's had a negative experience with going to the GP or going to the hospital, the emergency department, they're less likely to go again. And so even if they think they might have, you know, their back's getting a bit more sore, or they've noticed a change in their skin, we know they're less likely to go and get it checked up unless they really need to. So I think, you know, it's important to look around for a GP that you like. Sometimes that takes a little while, going to a few different GPs, Perhaps it's checking in with, someone like myself to see if they've got any, you've got any recommendations, or checking in with the CP community. So we have our Facebook groups, we have Tribe, our member groups, who perhaps do have a recommendation for a GP that understands adults with disability and will provide that more holistic and comprehensive experience.
And it shouldn't go without saying that they can always call you as well, right?
Absolutely, yeah, for sure.
Telehealth nurse,
and look, I get people ask that all the time, and sometimes I can help, sometimes I can't. I'm certainly building up a bit more of a list of GPs that do have a bit more knowledge of CP, but there, still really is a lack of healthcare for adults with CP. We know that there's a lot of intervention for children, a lot of doctors that specialise in a lot of allied health that really help with all aspects of the child. But once we get into adulthood, those services drop off a little bit. So that's certainly something that, we're all looking to change.
So there's quite a few questions I want to go on a tangent with there that I hope is okay.
Absolutely.
We've been talking about, having different people to go to, and one of the things we keep talking about is pain, back pain, osteoporosis, aging. I know this is something I worry about and I've become more conscious of in the last few years. So aside from seeing their GP, would you say, people with CP should be utilising their NDIS and should be getting more specialists in their lives? And if so, who do they go to?
Yeah, absolutely. I think one of the best things I've come across is neurophysio. I think neurophysio is really beneficial for adults with CP in terms of working on their bodies, maintaining strength, maintaining balance, working on their goals. And then when needed, perhaps they might need to, go to an osteo specialist in the health system. So that would be aside from NDIS. But I really think that neurophysio or even, a traditional physio with a good understanding of adults with CP can be really helpful in designing, an exercise program to prevent any further, their body deteriorating or changes to their body as a person becomes older.
So another thing you touched on there was screenings, regular screenings. And this is something that's actually come up with past people I've spoken to who said they didn't feel like they had proper knowledge of their body, like how frequently to get cervical screenings, breast screenings, things of this nature. So how frequently should we be getting those screenings?
Yeah, absolutely. And look, screening starts right from really early on. So when babies are born in Australia, they have their hearing screen, they have their newborn heel prick test, which tests for a range of genetic disorders. So, in Australia, we have opportunities for health screening from really early on. As we move into adulthood, we know that a woman should have regular pap tests. So I think it's between 3 and 5 years now, depending on what test you're having. Breast checks is something that women are encouraged to do regularly, and is not something you necessarily need to go to the doctor for, but generally they're linked in with other regular health checks. And then we know that when adults get to 50, there's the bowel cancer screen, so a stool sample that tests for the risk of bowel cancer. There is some prostate testing and also mammograms for women.
And I guess another thing I wanted to ask you is, obviously we're talking a lot there about what adults can do for themselves. What can parents, caregivers do to assist with preventative healthcare?
So I guess, like I mentioned before, for children, so one of the first things my boys were linked in with was hip surveillance. So for children with CP, they start hip surveillance from very early on. And for most children, that starts at 6 monthly. Where every 6 months they have a hip x-ray to look at the state of the hips, and then that might change to yearly, it might change to 2 yearly, depending on how things are going. I guess also, for parents and caregivers, and this is for any parents, it's about instilling healthy habits, in your children, talking about ways that you can prevent serious illness, talking about, putting on sunscreen. I think Australian children, it's all, and that's actually one of the most successful health promotion messages there's been, the good old slip, slop, slap. I think Australian children are really good at knowing sun smart rules. I think that's really important for parents and carers to continue to talk about that with their children, and even into adulthood, where an adult with a cerebral palsy also has an intellectual disability, perhaps it's, instilling those things, longer into adulthood. And I guess making sure that they're aware of the timeframes for, screening, preventative health checks, heart checks, things like that.
I think those are all really good points, because of course, and support workers as well can help with this if they have concerns. Maybe they need to ask their clients, have you spoken to your doctor recently?
Absolutely.
People look out for these things. So we may have already touched on this somewhat, but people with CP, I should say, are at a higher risk for things like arthritis and things of that nature. How can we practice better pain management?
So again, I think it really starts with the relationship with the GP, discussing your pain levels with your GP, with your primary health practitioner, and monitoring that over time. I guess it's also around intuition, knowing your body, knowing what's right for you, and if something doesn't feel right, going to your GP, checking in with one of your allied health. We know that pain management isn't always up to scratch for adults with CP. There certainly is high levels of uncontrolled pain reported in the adults with CP community. And so I think it's really important to, value that intuition that something doesn't feel right, something's more painful than it was, and checking in, seeing what can be done. We have a lot of great pain specialists now, pain nurses, pain medical practitioners that people can be linked in with. And I think most of that generally starts with the GP and, linking into a clinic from there.
One thing we haven't touched on here is obesity. And that's a really contentious issue, I feel like, these days. So how can obesity tie into everything we've covered today?
Yeah, absolutely, Nat. So, we know that unfortunately, obesity is becoming more and more prevalent in Australia. So this is in the general population, along with adults with CP or disabilities. So in the general adult population, we know that 67% of adults are either overweight or obese, and 25% of children are now overweight or obese. So it's certainly a really big public health matter that, the government, the health system, NDIS is looking to work on. So again, I guess it goes back to, teaching your kids healthy habits, maintaining regular exercise. And for adults with CP, it's around, working with your allied health, your GP, your medical practitioners around an exercise and dietary program that works well. So we know with CP that there is a percentage of people with CP that are very underweight, that have problems with maintaining enough nutrition. And then there's also a percentage of adults with CP that are on the, overweight or obesity. And often that revolves around nutrition, but also inability to exercise, in a traditional sense. And so finding accessible exercise classes, accessible sports, inclusive, sports activities is so important for adults with CP. There's quite a big range of activities now, and that's something that I like to chat with people about all the time. So certainly finding a program that works for you and keeps your body moving is really important.
Yeah, it's an interesting point. It's something I definitely identify with in terms of managing my mobility as I get older, and how that ties back into my waist circumference. So in fact, I'm doing an article on it this month, but I wanted to ask, if I were to say go searching for activities, because I do some things, like, for example, I like to go swimming, but where else can I find suggested activities?
Yeah, so really good question, Nat. Certainly All Abilities Australia is a really great organisation. I think there's some more local Victorian organisations which talk about all abilities sport, all abilities activities that anyone can join in. There's also really great programs now, seated yoga, wheelchair sports. There's a really big range of inclusive and all ability activities. It is just about getting online and finding those. But, I know even for myself, I've looked into all ability sport for my boys, and, a simple Google search, and I was able to find all ability soccer, all ability football, all ability basketball. There's quite a bit of, mainstream sporting associations that are now working in all ability sections. So, for example, Auskick, a lot of Australian kids do Auskick from very early on. Auskick now has an all abilities program, as do a lot of the other sporting associations.
So I think that's a really good point there. You mentioned the NDIS. Does the NDIS provide any preventative sort of healthcare related measures?
So in a way, yes, in a way, no. So the NDIS won't do what the health department or the healthcare system is already doing. So anything relating to medical healthcare, so going to the GP, having your health checks, no. However, when we think of preventative healthcare in terms of exercise, diet, then NDIS covers dietitians, so you can link in with a dietitian or nutritionist. It also will cover exercise physiology, so I know that can be a really good place to start, rather than your traditional physio that's looking around kind of muscle strengthening and so forth. An exercise physiologist can actually design a tailored exercise program for you. So linking in with allied health in those professions absolutely can be covered by NDIS.
That's good. And one final question, where can people seek out more information about preventative healthcare?
So they can certainly give me a call. Always happy to chat about preventative healthcare. It's something that, as you can see, I'm quite passionate about. Otherwise, like I said, the GP is a really good place to start. Or a trusted health practitioner, a trusted allied health, someone that works within the health industry. More and more is going to have a really good knowledge of this, because we know that it's really important. We know that it's certainly so important to public health, and it's so important to people with disability and people with cerebral palsy. So I think just checking in with somebody in your network is really important.
Awesome. Amy, thank you so much. Always a pleasure to sit down and speak with you, and I'm looking forward to our next installment, where we are doing a continuing look at preventative health, and I think I've even forgotten what we're focusing on.
We might look at reproductive health, Nat.
Yes. Okay.
Thanks so much, Nat. It's always a pleasure to sit down.
Thank you. Bye.
CPSN's member service is 100% free to join and gives you access to a number of support services, including Telehealth with Amy. To become a member, call us on 0394781001 or visit cpsn.org.au.